Dysautonomia. Now, if you're watching this video, odds are you've heard of that word for your kiddo. And it can be pretty challenging in today's healthcare system because traditional medical providers may not be familiar with it. They may misunderstand it. They may not even be looking for it in your kiddo. And as a result, not be able to identify it and not know what to do to help. As a parent myself, I know we want our kiddos to be healthy and thriving and loving life. However, if your kiddo is dealing with a health challenge, maybe it's a chronic immune issue, autoimmune issue, they get sick all the time, maybe they have digestive troubles, they're always constipated, maybe it's a stressed out brain and nervous system, things like anxiety, ADHD, sensory processing issues, autism, all those things can have in common this term dysautonomia. So in this video, I want to explain more about what it is, and I'm going to share with you 5 triggers that we see commonly in our office that put kids into this state of dysautonomia. And that's going to allow you as a parent to see, maybe that is a contributing factor for my kiddo. And as a result, I'll share with you then how we help in our office and what you can look for to help your kiddo as well. So I want to, before I jump in, I've got a couple of things here I'm going to go over. But before I do that, I want to share what the term actually means, because since it's a term we don't hear super often, what it means is dysautonomia. Auto is automatic, so it's a part of our nervous system that is running everything in our body that we don't have to think about. We eat food, we don't have to think about digesting it. We encounter a virus or a bacteria, we don't have to tell our immune system how to fight it off. When we're winding down for the day, we should have a natural rhythm in our nervous system to calm ourselves down to go into sleep. So if our nervous system isn't regulating itself, can be in this state of dysautonomia. Most often we see is stuck in a state of fight or flight. So our nervous system has a gas pedal and it has a brake pedal. In today's world, we get gas pedal often from the moment we wake up in the morning. From our go, go, go lifestyle to get the kids out the door, we get to work, they get to school, they've got homework and after school activities, we've got deadlines and projects, and we're trying to run the family and the household, and maybe there's more processed foods that have I was talking to mom this morning. She's like, yeah, when my kids eat sugar, I see that gas pedal go, go, go. So I'll share some of those triggers here in a moment. But when we have the go, go, go mode overwhelming the brake pedal mode, it can start to shift our nervous system into this chronic state of fight-flight response. So some of the other things you might be experiencing in your life or your kiddo's life that could clue you in to this state of dysautonomia are the heart rate. We see things like POTS, which is has to do with blood pressure dropping, people who faint, or maybe you have high blood pressure, really fast heart rate. That can be a characteristic. As I mentioned, if you're in a chronic state of fight-flight, anxious, nervous brain, we see that in even younger kiddos now than we've ever seen before. If you're sweating all the time and just feeling like, man, I just never feel calm and grounded. If you're always in gas pedal mode, revving the engine, you're going to feel less energy, maybe short of breath, feeling thirsty all the time, trouble swallowing, so affecting this part. Maybe your kid is like a really picky eater. They don't want to eat anything but carbs and sugars because their nervous system is revved up and they need that fuel for energy. Feeling soreness in the body, maybe it's muscle aches and pains, maybe it's headaches, feeling nauseous, sometimes that can accompany anxiety. Obviously, when the gas pedal is on, we don't want to worry about digesting our food and can affect digestion. If we get real loose stools, it's because food's just coming in and it's moving right out. For other people, the food might come in and the body's in stress mode, it just sits there, kind of sits heavy in our belly, or leads to constipation, and then vision can be affected as well. So in the case, as I mentioned earlier, we'll also see kiddos with that diagnosis of ADHD, sensory processing disorder, autism, anxiety, because the brain is just stuck in stress mode. So this video, I want to share with you the 5 main triggers that we see In another video, I'll share the link in the description here. I go over more of all these factors, why they can be linked to one common thing called dysautonomia. So if you find your kiddo is struggling with multiple health challenges, make sure you watch that video as well, as it really paints the picture for you why they can be connected. So when we look at dysautonomia, it's a state of the nervous system. And we know now more than ever that the nervous system in a developing fetus, when baby is in mom's belly, the nervous system is picking up imprints of the world. It's taking in all this information and deciding, is it in a safe environment or is it in a stressful environment? So if mom is stressed during pregnancy, it can start to wire that stress into baby's nervous system. Even for my own son, when my wife was pregnant, she was trying to wrap up a lot of work projects and get things settled to be able to take time off of work, and she was in constant go mode. When baby is born, one of the more common things we see is some sort of assistance or intervention that happens. Maybe it is C-section, forceps, as you can see here, vacuum extraction, having baby being pulled out by their head, or having a shoulder stuck, being induced, or having labor stall. If labor is actually on the other side of things, sometimes baby goes really quick through and baby shoots out, and that can create challenges as well. We've had a kiddo recently whose cord was wrapped around the neck a couple times, and came out as a blue baby, which was a huge stress early on. So if you look back, we had a kiddo start last week with a lot of anxiety and sensory issues, and he had a vacuum extraction birth. And we can actually see on his scans, because when he was pulled out by his head, it affected his neck. And that can send a lot of stress into the brain. As we go now through infancy and toddlerhood, if the nervous system is stuck in fight or flight mode and you found your kiddo was struggling with milestones, maybe it was rolling, sitting, crawling, walking, and they never got things integrated properly, that can be a sign that their nervous system was stuck in this stress mode early on. We also see kiddos with colic or reflux, not sleeping well, constipated. Those all too are signs that the nervous system is in this imbalanced state early in life. As I mentioned earlier, dysautonomia can affect the immune system, because if we're in go, go, go mode, as you've probably experienced yourself, maybe getting through the holidays, and at the end of the holidays, you just sort of crash, and that's when you get sick, right? We get sick more often when we're under stress, when we're not taking care of ourselves, when we're not having downtime, we're just going, going, going. That gas pedal can overwhelm us, draw our reserves, and we're more likely to get sick. So in a kiddo, that might look like a lot of strep throat or ear infections. Maybe it's a lot of croup or RSV, lung issues, or they get a cold and it just lingers for weeks and weeks and weeks. That chronic immune challenge early on can be a sign. And then, of course, if you add a lot of antibiotics, that starts to deplete the immune system and can trigger more inflammation in the body. And we know now that inflammation in the gut can send inflammation into the brain. And then the last one here, we got an extra number here, so there are 5 bullet points, even though it says 6. The chronic sensory challenges and anxiety. So if a kiddo's nervous system is stuck in this fight-flight state, what we see is the sensory input starts to come in too noisy, too overwhelming, not integrating into the brain. And now it starts to trigger fight-flight in situations that should be calm for a kiddo. Maybe it's lights and sounds at a movie theater. Maybe it's a birthday party. Tags on clothes, textures of foods, sand on your hands or grass on your feet. All those things with time, while they might be overwhelming right at infancy and early on, the brain should be able to integrate those sensations and start to get used to them. If your kiddo's stuck in fight, flight, and dysautonomia in this imbalanced state, those things never get integrated and they can turn into sensory issues later in life. And as a result, lead to anxiety because the world just doesn't feel calm. It doesn't feel safe. So if any of those stand out to you, like, we did have a challenging birth, or yeah, my kiddo had a lot of ear infections, or it does feel like they just never settled into their body. When I was holding them as an infant, they always felt kind of tight and stiff, and they never relaxed as much as I thought they were going to. Those could all be clues that your kiddo's nervous system has been stuck in this state for a little while. So one way that we measure for this stress in our office is a scan called heart rate variability. And this is an example here. What this is measuring is overall, when stress in life is pushing down, if it's overwhelming us and we can't quite hold up and push back, it starts to overtake and trigger that chronic fight-flight response. It starts to lead to less resiliency. It starts to use up our reserves in our body. You can think of it like the battery on your phone. If you're running a lot of apps, shooting a lot of videos, watching a lot of movies, and all that bandwidth drains the battery. And if you get to the end of the day and you don't plug it in, you start the next day on a low battery. When it comes to our health, this heart rate variability is a way to measure how charged your kiddo's battery is, or your own battery for that in that case. The more charged our battery, the more resiliency we have when it comes to health issues. The lower our battery, the more some of these chronic health issues can start to show up. So in this young boy's case, he was 3.5, and he was actually an example of cord was around the neck and a blue baby when he started. Feel really bad, for mom and dad to be new parents and have that happen. And it started to take a toll on his nervous system early on. So his muscles were actually more low tone, more floppy. They never engaged fully. He just felt more stressed and would have more outbursts than mom and dad wanted to see. And you can see the first scan here we did on him, this little white dot, we want to see nice and solid up in the green. When it's outside of the green, that's an indication that the nervous system is starting to become imbalanced and not being able to handle the demands of life because it's just stuck in that stress mode. As we've been working with him now, this is 4 months later, just a scan we did last week, you can see he's nice and solid in the green here. So his body is building resiliency. Mom and dad are noticing his moods and tempers are much better. Sleep is better. He's starting to engage in life more because he feels safer and more comfortable in his body. So that is one of the key scans that we do in our office to check to see, is dysautonomia a factor for your kiddo? And more importantly, because maybe you already know that it is, if you're watching this video, you've been looking into it, it also helps us see whether or not we can help based on what's happening in your child's neurology. And that, as pediatric chiropractors who focus on the nervous system, our neurologically based technique is to help see, where is that foot stuck on the gas? How can we take off the gas, start to apply the healing mode, the brake pedal, and starting to create balance in your child's nervous system. If you want to find out more about why dysautonomia can link to multiple health things, check out the video I have in the link. And if you want to talk more, reach out. We're here for you. I'll see you soon.